So tell me your name, and tell me about your practice and what you do.
My name is Dr. Christine Arsenault, and I'm actually a pharmacist and a health coach and a hypnotherapist. And I work with people who have Lyme disease, who are dealing with pain and fatigue and brain fog. Those are kind of the big symptoms that most of my clients have.
Very cool.
Yeah.
Tell me about Lyme's disease and other than those symptoms, like how it affects people, how they get it, kind of where's a good starting point if you're recently diagnosed with Lyme's disease?
Yeah. Oh boy, where do I start? There's so many misconceptions and misinformation out there about Lyme disease. So the most common way to get it is from a tick, but that's not the only way. So there are other insects that can transmit it. It can even be transmitted sexually. It can be transmitted through childbirth, like through the placenta. So there's other ways that people can get it as well, but the tick is the most common way, the way that people are most familiar with. And then you can get a bullseye rash after you have a tick bite, but only about 30% of people get that. And if you get it like on your neck or like the back of your neck or your back or something, you might not see it. So that's one of the other issues is a lot of times people don't remember a tick bite because ticks are so small. They don't see the rash, so they might not get diagnosed till years later. So typically when people come to me, they might have been diagnosed with like fibromyalgia, chronic fatigue, these kind of diseases or diagnoses that don't really describe what the root cause is. They're more describing what the symptoms are. So that's one of the biggest challenges is a lot of people don't get the diagnosis right away, and then it gets into these more chronic forms.
Interesting. And how do you diagnose?
So the bullseye rash itself is enough to give you a diagnosis. Otherwise, there's different tests out there. The testing isn't 100% accurate because we're not testing the actual bacteria in your body. We're testing your immune response to it.
Okay.
And so, like if your immune system is really suppressed, if you have a bunch of different infections, you might not have a response, so it might look like your tests are negative. There's also the tests that they do in mainstream Western medicine are really outdated. So there's a lot of false negatives. But there are tests that you can do, and I use certain assessments with people as well to figure out like, is it Lyme disease or is it parasites or other things going on. A lot of times, so the tick is known as the dirty needle of nature because it goes on different animals and picks up different diseases. So usually it's not just Lyme disease. And Lyme disease is caused by a bacteria called Borrelia. But a lot of times people might have some other infections too, things like Bartonella, Babesia, parasites, viruses, things like that. So usually, especially if it's been a while since they got, if it took a while to get the diagnosis, then they may have multiple infections.
Wow. Okay.
Yeah.
That's crazy.
Yeah.
That's really crazy.